So we are excited and want to welcome everybody out in social media land. I am Dr. Kent Key. We are the Flint Public Health Youth Academy, where public health is everything, and everything really is public health. And so we're excited to be here. We took a month off to just kind of revamp and recuperate. And so we're excited to share with you all on today's show kind of what we've done these first 3 quarters of the year, and then what we're planning on doing the remainder of the year. But before we get into that, we have some awesome interns and mentors on. So I just wanted to give them an opportunity to shout out to you all. And then when you do your shout out, if you want to give people an update on what's new, some of you have gone to college for the first time, some of you are in your last year of college, some of you got new jobs, etc. So just want to give the people an update and let them know who and what you're doing and who you are. And as always, because we always have sometimes new people who are watching the show for the first time. So again, I'm Dr. Kent Key. I'm the founder and director of the Flint Public Health Youth Academy, and I am just so delighted to be part of such intellectual as well as a forget the talk, let's get to action type of aggregation of young people. So I'm going to just popcorn it and I'm going to pass it to Khalil. Khalil, go ahead. And then you choose someone and y'all know the routine.
Gotcha. Hey everybody, I'm Khalil Calvin. What's been up with me is I just started my second year of med school. I am a mentor. I was former staff for the Flint Public Health Academy. And I guess I'll pass it on to Kayla if she's able.
Hi, everyone. My name is Kayla Shannon. I am currently a senior at the illustrious Spelman College in Atlanta, Georgia, studying political science. I work locally. Let me first say, I think I'm a third maybe year intern with the Flint Public Health Youth Academy. And I also work locally with a couple other nonprofit and community-based organizations, and really proud and excited to be here with you all today. And I'll pass it to Vanessa.
Hi, I'm Dr. Vanessa. I'm one of the mentors for the Flint Public Health Academy, and I'm excited to see them growing and thriving. And it's like, wow, I have to kind of forget how old I am, but I'm glad to see that they're thriving and going to college and graduating from college and going to med school. It's like, wow, it's a pleasure to be here, to be in your presence. And I'm just excited to see what good work you have that's coming up. And I'll pass it to Amir.
Hi, everyone. I'm Amir Brown. This is my 4th year of the Flint Public Health Youth Academy. And I go to U of M Flint, just starting back up classes, going to my final year. So yeah, nice to be here. Let me pass it on to Cole.
Hi, my name is Cole Mays. I go to U of M Flint, and I've been in FIA for around 2 years. Christian.
How you doing? I'm Cole's brother, Christian Mays. Just about done with Mott now at for my automotive engineering. Good stuff. Very fun. Still working, but happy to be here, or happy to be here today.
And who you want to call on next, Christian?
I'll pass it to
Hello, everybody.
Go ahead.
My name is Everett Graham. I am a freshman at Michigan State University. And I apologize for not having my camera on because I got caught in the rain and I have a cold. But yeah, I've been with FIA for like 4 or 5 years now, almost since the start. And I'm glad to be back.
Everett, who's next?
Oh, my bad. Did Tashay go yet? Okay,
No, I didn't. Hi guys, my name is Taisha Brady. I am currently enrolled at Mott Community College for sign language interpretation, possibly transferring over to MSU for nursing and public health. Not quite sure yet. I would show my face, but I am getting my hair done, and I don't. I would prefer people not see my little egghead shape right now. I think I'm gonna pass it to. Did Amir go?
Yep, Amir went.
All right. Who did I miss? I'm trying to find. I'm gonna pass to Melissa.
Thanks, Taisha. Melissa Mays. I am a social worker here in Flint and run What Are You Fighting For? I'm Flint Rising, and I'm a mentor, and I'm just proud of seeing how our youth has grown and how strong of a voice they have and how wonderful they are. And I'm gonna pop it over to Jasmine.
Jasmine says in the chat that she is a mentor for FIA, 3 years epidemiologist, yoga teacher, and it's great to be back after our break. She said she had a minor dental surgery, so she'll be in the chat today. And I'll pass it for her to Gabrielle.
Hi, everyone. My name is Gabrielle. I'm currently a third-year medical student, so I apologize that I'm not on camera. We are signing out our patients in clinic. Been involved with FIA on and off for about 2 years. Had to take a hiatus to focus on board studying, but I'm just so excited to be back. So excited to finally be in Flint and be a part of the community. So excited about what's next for FIA. And I'm going to pass it to, did everyone go?
Nope. I think
Here.
Sarah. Yeah.
Yeah.
Hey everybody, I am one of the mentors. Sorry, I did not see this on my schedule today, but I'm glad I checked my email. I am a Flint native. I'm in my last 2 months of law school. What else did Jasmine put in the chat? Is that all you need from me?
Any
Okay,
updates?
all right.
Any updates that you want to share?
And then, last but certainly not least.
Well, I mean, we'll be done in 2 months, hopefully. So, just say your prayers for that, because this is the most ghetto 2 months of my life. Like, I got like 6 papers to write. Any other updates? No, really just the same, work in school. Winslow got his shots today, so he's at the nail salon with me because apparently I can't leave him alone after the shots. I never thought I'd be one of those people to bring my dog in public, but here we are.
All right. Can you all hear me? I think I'm having some connection issues. Can you all hear me clearly now? Okay. All right. So we want to start our conversation by
Oh,
recapping.
wait, Dr. Bailey didn't go.
Oh, I'm sorry. Go ahead, Dr. Bailey. And
Yes, Dr. Reverend.
I'm gonna transition to another room while she talks. So stall for 1 second, Dr. Bailey.
What do you say after that? Hello, everyone out there. I'm Reverend Dr. Sarah Bailey, and I am the administrative consultant with Flint Public Health Youth Academy. And we had an awesome summer camp this year, had an awesome visit with Dr. Vanessa from New York. That was great. Had some youth, FIA youth do some awesome things this summer. Maybe some of them will tell you about some of the things that they did. What's going on with me right now is that I am also transitioning into a leadership position with the University of Michigan's Michigan Institute for Clinical Research as the community lead, which is one of the, I guess you could say, leaders of that illustrious program there. And many people have been connected with the University of Michigan's Michigan Institute for Clinical Research, for health and clinical research. And so I'm really excited about that. there's some excited things that we're doing. We are a CTSA, and that means a clinical translational science awardee. And so we'll be doing a lot of different projects and looking forward to having a lot of projects come from community and community organizations in reference to some of the work that they've already done and how they plan on. Our focus this time is on dissemination, not just writing papers, but how you're going to get all of that wonderful, good information that you have out to the people in the community. So that's our focus. Dr. Key, I see you're back.
Yes, thank you so much. So sounds like you all have been busy. We have been busy. And just so y'all know, Dr. Vanessa, when she did make her Flint visit from New York, she put out there, hey, I'm in Flint. Anybody want to come and hang out with me? Let me know. I put it in the group me. Only a couple of people responded. And actually, anybody that came, she gave them about $100 just as a love gift for coming to see them. So I couldn't tell y'all, come get this money.
Wait a minute.
The youth, not you, Dr. Bennett. That don't count for you.
Okay.
Don't count for you. We talking about the young people.
Okay, because I know I didn't get my 100.
I know you're going.
I'll catch a flight to New York right now for my 100.
I kept putting
I mean, I should do that now. All you want to do is not to pay me $50.
Anybody want to come hang out? Let me know. She's here. Hey. But anyway, we had, and it was so good for her to be.
$35, right?
And so let's talk now about the many things that we did this year. Are you all there?
We're here.
Are we
No,
froze?
we're not. No.
The many
No.
great things we did this year.
Okay, so we started out the year with our mentoring show around Martin Luther King Day. And we've been doing this probably for the last 3 to 4 years. And it's all about mentorship. And just any of you mentors and interns, just give your reaction or reflection, or just share with our audience what mentorship really means for you. Has mentorship been something that's helpful? Is that something old and antiquated? Or what role has mentorship played in your overall development as young professionals for your career-wise and academically? That's my initial question.
Start. I mean, simply put, I don't know that I do know. I know that I would not be where I am in the positions that I am, stepping into the rooms that I do, without the plethora of mentors that I have across Flint and Genesee County. I'm so proud to have such a great network from teachers to professors to mentors associated with organizations like this that pour into me in ways that they are not required to, not paid to, is not in their job description. And I'll say especially with this group, being through this organization, being able to be exposed to, first and foremost, the field of public health has been life-changing for me, because in so many ways it speaks to, you know, what I've been pulling towards, right? And didn't have a name for, didn't know how to describe well. And then in addition to that, being connected to opportunities, being able to do things like go to the APHA conference and present, and being connected to a job opportunity to host a talk show that, like, I've never hosted a talk show. I've only ever been on this talk show. So, right, the stepping stones that have been built through mentorship have meant a lot to me, and they've definitely been life-changing.
Awesome. Anyone else want to just speak briefly on mentorship? Everett?
I can. I just mainly to agree with Kayla was saying, it kind of mentorship has put me in a position to where I can learn and grow without some of the mentors that I've had. And they come in many forms, like Kayla was saying, teachers, just people in the community, parents, family members. Like without those people, I would not be in the position that I am today. And another, like one of the points of our thing, our mentorship like event earlier this year was to kind of highlight these mentors and, you know, give them thanks, because without them, a lot of us wouldn't be where we are. So I do want to highlight that and raise that, just to say thank you to all those mentors who have, you know, played a part in our lives and molded us to be the way that we are.
Awesome. Amir?
Yeah, I full wholeheartedly agree with both those sentiments. I think mentorship for me, especially like me being, I was a Boy Scout playing piano, all this other type stuff. Like I wouldn't be in those positions without, you know, good guidance, good mentorship, or like, even in this group, we got opportunities to do all this amazing stuff. And, it wouldn't be here without the guidance, Dr. Key, Dr. Bailey, all our mentors here. So yeah, I think it was a big part for my development, especially being a young man. So yeah, just showing gratitude and giving thanks to, the different people in my life that helped me down the line. So yeah.
Thanks for sharing, Amir. Anyone else?
I can add
Well,
something to
I would
that.
like to, go ahead.
You want
Go
to
ahead, Chris.
Okay. So I think there's also the value of having mentors who look like you, also doing these amazing, wonderful things, and then having them reach out to you and bring you up to those same positions. I agree with everyone else. I wouldn't be where I am without having like wonderful mentors and having the experiences I had, like working in public health and knowing that I wanted to integrate that into pretty much anything I wanted to do as a doctor or practicing doctor. So yeah.
I just wanted to share that I think it works two ways. Being a mentor and pouring into somebody else's life is rewarding and fulfilling. But what a lot of people don't understand is that our mentees pour back into us, and they share with us the world that we may not understand and know. And watching them grow is also exciting, especially once you reach a certain age. And there are a lot of things that you can't do anymore, but you know that by extension, through these young people, it gets you to some of those places that you might have dreamed about going to, but you're seeing it now materialize in some young person's life. And I that is very rewarding. So for those folks that are out there that are thinking about mentoring, it has its challenges, but it also is very rewarding.
And then Jasmine put in the chat, I would say that mentorship is really important. In my professional life so far, having mentors has been very helpful. There are benefits like having people literally remind me not to play small, write, share their experiences, let me cry, and give me career advice, whether I take it into action or not. As a mentor, I feel like it has been good for being able to talk to people younger and older than me and help share insights and lessons so that the path is easier for my mentees. Very grateful for all of my mentors and those who I have the privilege of mentoring.
Yeah, and that is a very big piece when Jasmine was talking about writing letters of recommendation. Oftentimes you all get opportunities for scholarships or we get opportunities for new jobs, and people want to hear from people who really know our skill sets, our character, our ability to engage, etc. And mentors really have a good grasp on that. And so that's another thing that I think Jasmine was talking about. So as we continue to move forward, after that January type time of the year, we continued our long COVID messaging. I know we had some people on that have lived with long COVID. We had a couple doctors, a couple nurses on to really talk about it. We had some public health professionals talk about it. Why do you all think that that messaging is important, and is it still important today? Because we were still talking about it when folk were like, y'all, COVID is over. Why y'all still talking about COVID? But we're not talking about COVID. We're talking about long COVID. It's a whole nother situation. Go ahead, Amir, and then Everett.
Yeah, I think that it was a very important topic at the time, and also now because there's more strains, different strains coming out, and especially you got to be aware because some of my friends, some of my family members have continued to get COVID even after people think, oh, this wave is has left, and it's still a very very important thing to know that people need to watch out for and be very aware of, because especially to be courteous to those around you, and like you don't know how you might react to these different strains of COVID that are coming up. So I think it's a very good message and very educational, and we learned a lot from it. So yeah.
Thank you, Everett. Then Melissa. Everett. Then
I'm sorry, can y'all hear me?
Yeah, we hear you now.
Okay, sorry. Yeah, I think that I agree with Amir, but I also think the message is important just because of the simple fact that we have so little information about COVID. So when there are, scientists who are saying, hey, we have this evidence that's explaining that once people get COVID, they often have these effects that also follow that. I think it's important that we need to listen to that stuff because there's so many unknowns still with COVID, and you would think after living with it for 3 or 4 years now, we would kind of know what we're doing, but we still don't. So it's important to take that information and heed to it and listen to it, because a lot of people are still living with long COVID and things like that, or things as a result of that, and they still don't know. So it's important that we not only push that message back then, but that we continue to, because it's a lot of people out here who still have no clue what's going on.
Thanks, Melissa.
Absolutely, exactly what Everett and Amir said. I mean, as somebody with long COVID, things continue to come up and change, and things are still going on with my health that the doctors don't yet understand. So as the doctors and scientists are learning and the public health officials are learning and, catching up, we need to make sure that the public is as up to date, especially from trusted voices as they can, and making it as apolitical and as fact-based as possible. So hopefully it doesn't come up and surprise us again like it did when it initially hit, because, being, at the time in 2020, as advanced as we were, it really took us all by surprise and it was so devastating. So hopefully if we continue to educate and talk about this as things change, the next time something like this hits, maybe we'll be a little more prepared.
Absolutely. Absolutely. Well, we had a whole series on long COVID, and we began to start generating a lot of conversation in the community. And as we were wrapping up that period of the year, we started introducing our campaign for 2023, which is our gun violence campaign. And literally, like, the week we said we were going to introduce it, it was like 4 mass shootings across the country in that same week. Anybody want to just kind of touch on our kind of focus on gun violence and why we are choosing that as our focus for this year? Because it carries over into the summer camp discussion, but just that initial reason why we chose it.
I feel like with every new topic that we choose for the year, we focus on what's affecting our world currently, right? Like what we do our best to choose a diverse set of issues that are equally impacting communities around the world and impacting, therefore, public health. And so for us, when we began the conversations about gun violence, I feel like it was almost a no-brainer. Like when we were thinking about the next topic, it was brought up in conversation and it just made sense. For one, because we recognize that like the instances of mass shootings are becoming increasingly prevalent, right? And there continues to be a lack of, our government refuses to address it because of connections with the NRA and people who have a lot of money or receive revenue from the gun industry, many of who are in government themselves. And so we thought that it was necessary, of course, for those reasons, but also in addition, Black and brown communities are no stranger to everyday instances of gun violence, right? We recognize that that whether it be that many people their homes have been touched by gun violence, just individual instances, drive-bys, shootings, not necessarily in classrooms and maybe not mass shootings, but it still has had the same impact, right? When we look at the numbers and the statistics. And so for us, for me at least, it felt necessary to have the discussion about something that once again continues to impact so many different lives in a diverse set of ways.
And I think the timing of it, like we started normally around November, December, we start kind of looking at what we want to focus for the upcoming year. And so the conversation started then. That was before what happened in Oxford, here at the high school here near Flint, and that was before what happened at MSU. And then it really just started hitting home in a real way. And especially with MSU, because we have so many people that we know who work in that building, who have classes in the building where it took place. And so, yeah, for me, I'm with you. It was a no-brainer for me, Kayla. Anyone else want to touch on that before we transition to our next timeline topic? Go ahead.
Yeah, I thought, I was thinking back at the time that this started, that we started talking about this. One of the things that I think we were coming out of 2021 and we had seen the surge in gun-related deaths, and it exploded into 2022. And we began to realize that it was the leading cause of death amongst children, especially school-aged children. And that it didn't matter your ethnicity. It had just got totally out of proportion. And so I think it was a topic that for a lot of young people, they wanted to have an opportunity to speak on it, to speak on what was really going on. And it was really impactful to have young people leading the cause in regards to what was happening with gun violence, especially as many of them were being impacted the most by it.
And we'll continue the gun violence conversation, you all, because that carries over into the summer camp and into some of the other things that has happened throughout this year, because we're still in the campaign. But the other piece that I wanted to also lift was we had a health summit, a youth summit. And this was like around May. And so we walked from January now we're into May of 2023. And for those of you that attended, kind of share what that was like. A lot of people were pretty shocked at how many young people came out, how many people came out. And then it was 2 days. You know, the first day was at MSU. And I think you all kind of talked about what you all have been doing. And then the second day was at the food bank at their conference center. And young people began to kind of talk about what they would like to see in Flint and how Flint and Genesee County could be less violent, et cetera. Anybody want to recap what you recollect from those experiences? Amir?
Yeah, I think especially when we went to the food bank and we were in the circle and we were able just to share stories and, you know, connect with each other. And, you know, I think also just sharing the dialogue was really was really helpful. I think just seeing how we can help the community out and see how ways we can all be better as a whole. I think that was great. Especially like the different variety of age ranges from got high school kids, college kids, all the way to middle-aged adults and also like the elderly and things like that. And I think that was great. Great to see just out here just breaking barriers between people in different age groups. So yeah, I really enjoyed it.
Yeah, and the youth were able to facilitate this conversation, like you said, with an intergenerational crowd, right? And I think that is so important, is that a space was provided where youth had just as much influence, just as much right to speak, just as much respected opinions, suggestions as grandmama and great grandmama, right? So I think that was pretty dope. Anybody else want to talk about what we did? I know on the first day, you all presented to the crowd, right? And I think we had about 58 people on the first day and almost 70 on the second day. Anybody want to share what that was like? Just kind of sharing what FIRE was doing and kind of reporting back to the community. What did y'all talk about? If y'all remember, it was in May. Anybody remember?
I can just talk a little bit from my perspective. So for everybody who wasn't there, doesn't know, I was only able to be there the first day, and that was the day that we kind of gave an overview of FIRE, kind of like how we're doing right now. We talked about some work that we've done in the past and how that work has a direct impact on not just our community, but communities across the US. We talked about how we're starting a FIRE chapter in Brooklyn. We talked about how through our social media and through our impact at APHA, we were able to create a partnership with the Amputee Coalition. And we talked about how our first kind of meeting with them and interaction with them went in Chicago. And yeah, essentially we did what we're doing now and just kind of gave an overview of what we did at APHA, what we did in Chicago, and what we've been doing via social media and all of our other campaigns throughout the years.
That's right. And I think Kayla started out with the kind of giving an overview of our Racism as a Public Health Crisis Youth Dialogue Report. And so again, the work that you guys have been doing and is doing is still groundbreaking for youth groups, right? You have adult groups who are still trying to figure out how to do a lot of what you all are doing. And so you did mention, you did mention about, we did travel to Chicago. We had a road trip to Chicago, and all the dumpsters say something, say hey or something. That's a joke because there was a place called The Dump that was a furniture store, and we just had so many dump jokes based on that experience. So it's really, you had to be there to really appreciate the gravity of it. However, in that health summit, we were partnering with, as Everett said, the Amputee Coalition. And anyone that went on that trip want to share what that was like? For the health summit, it was their luncheon, actually, and it was in May as well. Any takers?
I could talk again. The Amputee Coalition luncheon was actually really fun. The purpose of that interaction was to kind of get acquainted with the Amputee Coalition, because that was really like one of the first times we've interacted with a group that we haven't had a foot in, if that makes sense. A lot of the groups that we interact with in Flint, we have like relationships and such with those people, but this was the first time interacting with the organization, which we had no real, standing with, no real relationship with. So we went down there, we got acquainted with the youth, we got acquainted with their mentors, and we had a really good time. We got to talk to the youth a little bit about public health and, what applications that may have in their life. And it was a really impactful, conversation, a really impactful event, just because we were able to not only go there and kind of teach things, we also learned a lot while we were there, just about some of the things that comes with being an amputee as a youth, or comes with being an amputee in general. And following that event in Chicago, am I getting too ahead of myself, or?
Yeah, we're gonna
Kinda.
we're gonna jump on that after the summer camp.
Okay.
But what I will say is, y'all didn't just talk to them, right? You all presented, had a formal presentation with interactive games, introducing what public health was, to open up their eyes, one, to the field, and secondly, to the fact that they are underrepresented in that space and the need to have that voice and for them to advocate on their own behalf. And I think that was pretty awesome. Also, you all were able to be on their podcast, and some of their youth were able to be on our Youth Perspective talk show. So we were able to exchange. And for those that don't know about the Amputee Coalition, it's a national group. It's a national organization of limb lost and limb different people. And so they have the adult, department of it, and then they have the youth department of it. And so we were able to partner with youth that have limb loss and limb difference. And it has been a magical experience for us. So after the Amputee Coalition situation, and we were there for their luncheon, the mid-year luncheon, then we partnered with the Black Millennials for Flint, Mott Community College, and many of our other mentoring collaborative groups, and we launched our annual summer camp. Y'all know my motto. My motto at the summer camp is send us the kids nobody else wants, right? Because some kids, some of your more polished kids, or as people perceive them to be more polished, they tend to get all the programming and all the extra, curricular support and enrichment program support. But we want the kids that seem like they sometimes fall through the cracks. And so we had a whole 2-week camp. Anybody want to talk about that camp? Of course, we focused on gun violence. Of course, the Black Millennials focused on environmental health, but they framed it, violence was the overall topic. We talked about it from a public health perspective. They talked about it as environmental violence. How are we being violent to the environment, right? Amir, go ahead.
Yeah, so it was a lot of fun overall. I had a good time with it. A lot of the kids, they reminded me of my siblings. As far as they're able to to joke around, but when they got straight to business, they were on business. They learned a lot of variety of different things. I know me and Everett had a fun time trying to keep track of them, but yeah, overall I think they really came out of it knowledgeable and really learned a lot from it, and every single one of the instructors that were teaching did a phenomenal job. And so yeah, overall the camp was I think a huge success, and I'm for sure gonna be back next year. So yeah.
Thanks, Amir. Anyone else want to share?
I do. It was such a great experience to just be in the company. It's always so nice. I say youth, I recognize that I'm a young person as well, but younger youth.
I am too.
We all are.
We are.
But it's always nice being in the company of young people who are interested about public health. I think especially because I wasn't exposed to public health until I, of course, joined this group, which was when I was 18-ish, which, I was still young, I know, but young, 10 years old, talking about public health, understanding the impact of public health. And I think especially for me, seeing that in communities where we are impacted the most disproportionately by these public health issues. It's integrally important, fundamentally important for these young people to have an understanding of what's happening in their community, to be able to put a name to it, to be able to diagnose, right? And so it's so empowering. It's always such a good experience to just be in the room with them and see them excited about it, and to see them make it their own. Seeing this summer, us being able to integrate TikToks, which is something that like, you know, I actually think it's funny now because I'm thinking back to the panel that we did with U of M Ann Arbor, when I was like, you just need to do a TikTok. Like if you put it on TikTok, the young people will listen. And so it was really nice to see them like make it their own and enjoy it and have fun with it.
Awesome. And one of the things I wanted to also say is we had a very special guest, right? We had the president of MSU come, and she was so taken back because first thing we did our dialogue session about gun violence. So she could hear directly from the young people. And we're going to package that up in a report very similar to the report we did in our dialogue on racism as a public health crisis. But we also did a recap as I was asking you all questions, asking the young people about what is data, what is quantitative analysis, what is qualitative analysis, what's secondary data, primary data, what is public health, what are the sciences of public health, right? What is an epidemiologist? Like what are viruses, what are chronic diseases versus infectious disease, how are they transmitted? And they were answering these questions and she was just blown back. She was like, well, why don't you just give them a free MPH? And I'm like, exactly. And it goes back to what Kayla said. These kids were as young as 10, all the way up through 18. And imagine if we had that at that age, how much farther we would be. And one thing I like to highlight about our camp, not that I'm tooting my horn or tooting our horn, because I think all the summer camps in the city are wonderful. What I love about our camp is we're a science-based camp. There are a lot of camps in the summertime that are, sports, athletic, and all of that, which is wonderful. Athletics is a wonderful thing. But just the fact that we have the opportunity to add to that grouping of camps, a science camp, and young people actually come and are interested and are engaging, I think it's an awesome testament to not only you all being able to design effective programming, but also to the city of Flint. Because y'all know we were wrote off. Folk had wrote us off, right? We weren't gonna be smart enough to do nothing because we had drank that water that had the lid in it, right? So it was just a pretty exciting thing. Anyone else want to talk about the summer camp? Well, Kayla, as a result of that, we had 2 television pieces, right? We had the news come out to the summer camp, interviewed a lot of the kids and some of the facilitators, but then we got invited to ABC 12 to do an interview with Don Jones. Kayla, you want to talk about what that was like for you?
Yes. Once again, going back to just great opportunities and, things sort of coming out of the woodworks because I did not realize what I was walking into. I was like, Dr. Key said, come, so here I am. And then they bring us out to this studio and there's a set and they're like, 3, 2, 1, action. I'm like, wait a minute. They were like, yes, and it'll air on TV. I'm like, TV? So just to start, y'all, I did not know what I was there for real, but really great opportunity to talk with Don Jones, who actually has a daughter who went to Spelman. Just had to say, but to talk to her about the summer program and the work that we do here with the Flint Public Health Academy, Flint Public Health Youth Academy, and the importance of sharing these messages with young people and integrating these and integrating them into these conversations about public health. And it did air and it is available on ABC 12 on their website. So if you want to find it, we'll be there. And Dr. Key got to do his thing and he came suited and booted like he do. So definitely go find that.
And it's also on our Facebook page. If you scroll down, you will see Kayla and I sitting in the studio, and you can just click the link and it'll take you right to the video. The other thing is not only was her daughter Spelman, her daughter also has a degree in public health. I just thought I'd throw that out there so that the whole world would know that. And we didn't know any of this until we were there. So yeah, we had an awesome time. And the point is we're getting a lot of views. And Kayla, so what did you remember what the producer came out and asked us at the end of it, and he was so excited about it? What was he talking about?
Well, which part? Because he was really excited just to do.
He was like, Don, this needs to be a town hall.
Oh, yes, he was saying that it needed
televised
to be
town
a
hall.
longer. Yes, he said it needed to be a longer segment. He said that these conversations needed to be had, especially when we talk about gun violence. And he was talking about, you know, people having differing perspective on guns, but this idea that like gun violence prevention is not about guns. It's not about guns. Like we're not having a conversation about whether or not people should have the right to own guns. Nobody's coming for your Second Amendment right. We all get it. We all understand the Bill of Rights and everything, right? But it's a conversation about how can we prevent people from dying in the way that they are, right? How can we create preventative measures and systems in place so that we don't have mass shootings every other day, every day? It's something like that. If it's not every other, it's every, right? It's somewhere in that realm. And so he was talking about there being a need for us to have these larger community discussions. So be on the lookout, because maybe a part 2, part 3, part 4 on the way.
Exactly. I'm gearing up. I'm trying to tee it up for it to happen. We might even have to get on. Hey, call Oprah. Anyway, so we did the summer camp, and then right at the end of the summer camp, the very next week, some of us had to jump on the plane to go to the Amputee Coalition's national summer camp that was in Florida at the SeaWorld Resort. And Everett, I know you spoke earlier, but Asia's not on today. So you want to talk about what that was? I know you were going to transition into that earlier, and I stopped you because I want to kind of go in the time of when it happened. Go ahead.
Yeah, I could talk. Dr. Key took us to the club every single night. No, I'm just kidding. I'm just kidding. But we went down to Florida a week after the summer camp ended, which was completely exhausting for some of us, especially Dr. Key, because he'd be busy. But we went down to the Amputee Coalition. This time it was their national conference, and to put it in like the easiest terms to understand, we are now stamped, we are now signed. Our relationship with the Amputee Coalition is now solidified, and that was kind of the point of us going again, to be with them in this time. The main goal of this adventure was to not only spend time with the youth and teach them about public health, but also for them to teach us. We sat through a lot of their programming. We sat and we talked and listened, mainly to a lot of the youth and the different stories and backgrounds that they came from. And I think we spent like 4 days down there, 3 or 4 days down there. 4. Okay. Yeah, we spent 4 days down there, and for the majority of the time we spent it, with the youth and trying to create a better relationship with them. We went through our curriculum with them again, and we had some newcomers that we didn't see in Chicago. So it was really fun watching them kind of engage with the curriculum and the content, and not only just engage with it, but relate to it. We had youth from all over the place down in Florida with us. So when we would talk about things like the Flint water crisis, or we would talk about things like, one of the questions that we asked the youth was, does anybody live in any proximity to a landfill? And almost half the youth or more raised their hand and said, yeah, I live in proximity, to a landfill. And then we got to explain and talk about how that is a violation of your public health. And it was just a very impactful experience. There was so many jokes that were told, so many stories that were heard, and it honestly just set us up for the future to where we can hope and plan to continue to engage with these youth and move on to bigger and better, things. So it was really fun.
And we will do that. As we think about, and thank you all for that wonderful recap, because right after the Amputee Coalition meeting, I was like, I'm exhausted. I can't do nothing else. We went on a recess for a little while as the Flint Public Health Youth Academy. And actually, wait. Go ahead.
One more thing. We had, we're part of a collaboration, and that's the MLMD, which is mentoring leaders makes a difference. And we had some youth representation there, and I know Melody is on. I don't see
That's right.
Isaiah, but Melody is on, and maybe she wants to talk a little bit about what that was like to represent FIRE at the big table.
We can't hear you, Melody. You're unmuted, but there you go. Yep. Uh-oh.
We
And I
lost her.
think she had hung up because she was putting her AirPod away.
Yeah.
Okay. I don't know if she'll get back on, but I think that was very impactful for the Flint Public Health Youth Academy youth to be part of the discussion and conversation around kinds of programming that other leaders in Flint for youth are planning out, and having our youth to be a part of those plans. And we want to constantly make sure that when plans are going out in terms of what's happening in this particular area regarding youth, that our youth are at the table. And we've got a lot of plans coming up, but we did have to take a break because that's a lot of work.
And so we literally had a power pack program year this year. Coming, I think it was in January. I see Melody coming back. Go ahead.
Can you guys hear me?
Yes, we can hear you.
Me? I don't know why I can't hear you guys, but if you can hear me, I can just go.
Yes, we hear you.
Okay. All right. So I was just saying that it was really a great opportunity to be in a room with a bunch of other, well, I was on Zoom, but it was great to be with a bunch of other youth that had ideas to help the community and come up with different ideas to involve other youth and have like younger participants do things for the community. And we ended up coming up with a great like type of summit idea for youth in Genesee County to come to and do a food can drive and have mental health awareness tables and different things like that. And I'm just excited to do more work with them to figure out what exactly all of it.
Thank you, Melody. Thank you so much. And so that is still being worked out. She and Isaiah are at the table representing FIRE, and they will be working with other youth from the other groups. And that youth group is designing what that event will be like. And so we're just going to work with the rest of the mentors and the adults and get the funding and make it happen. All right, so we took a break. We're here now. We're getting ready for APHA. So in February, we submitted abstracts to APHA for 2023. We went and we already presented in 2022. And all 3 abstracts for the Flint Public Health Youth Academy were accepted. Our gun violence one, our effective youth programming one, and then our joint abstract that we have with the Amputee Coalition. And so we will be going to Atlanta in November to present at the annual American Public Health Association meeting. And so we will continue this work. We'll tell y'all more about it out there once we do it. And then we'll be wrapping up at the end of APHA. It's holiday season, and we're going to rest a little bit again, and then we'll be ready to hit the ground running in January of 2024. So y'all, this year has gone by very fast. It still has kind of somewhat been a blur, but we're just so excited that we were able to do as much as we were able to do, and to have the reach and the capacity to go beyond not just programming in Flint, Genesee County, but really taking our programming to national platforms. And so this again is a testament to the great work that the Flint Public Health Youth Academy, the interns, the mentors, the staff have been doing. And I again am eternally grateful that you all are a part of this. So anybody want to give out any last shout outs before we wrap up today's show? Anybody? Everybody hungry? Because my stomach rumbling too. Oh, Khalil said, yeah. All right, well, We want to thank everybody out in social media land for rocking with us as long as you have. Please continue to do so. Let other people know, let other youth groups know about our Youth Perspective Talk Show. Let them log in and watch. And we want to, again, to build relationships with you. So we thank you all for joining us for this episode of Youth Perspective. Remember our motto, public health is everything and everything is public health. Thank you all and have a good evening.